Good morning in Vancouver, Harvey.
Yeah, and good evening to you in Munich, Lars. Good to see you.
Yeah, great to see you. Be nice to discuss a little bit about the ILDS and what's coming about. You were past president of the ILDS, and yeah, as you know, the 24th World Congress of Dermatology in Milan was an incredible success, great attendance, a great scope of the scientific program. I'd like to ask you, what do you think were the main legacies of that meeting to dermatology? And what contributed to making that meeting in Milan such a success?
Well, I think that the main legacy of the 24th World Congress of Dermatology in Milan a couple of years ago was the fact that it continued a tradition that began, more than 130 years ago in Paris with the first World Congress in 1889. So we've been doing this for years and years and years, and we get together every 4 years to celebrate dermatology, to share ideas, share experiences, and Milan was just exceptional at doing that. I mean, the enduring legacy really is that it, and especially with what's happened in the last couple of years, it's taught us the value of being together and being connected. And it was just so exciting to be with everyone, to be in an exciting, vibrant city, and then to share a lot of really neat innovations in dermatology. And I think the thing that really pulled it off, made it one of the best attended World Congresses ever, was the combination of the enthusiasm and energy of our Italian hosts combined with the desire of us as dermatologists and all the other people in the dermatology community to want to be there, to want to share our experience. And so it just was a wonderful, wonderful experience. And I'm yearning to have that same thing happen at the next World Congress. So, Lars, I just was wondering, that a lot has happened in the last 15 months. And I'm just wondering, in the ILDS side, I know the ILDS has been working very hard. What are some of the things that have happened within the ILDS during this pandemic that are going to change for the future, and what kinds of things are going to have a lasting effect on the world of dermatology?
So I hardly dare say how much it's changed for us, because I think we're very privileged. And when we see the devastation of the pandemic around the world, then we consider differently the challenges that it brings to a society and how the society can attain its objectives. Improving skin health for the world is really one of our big objectives in a situation of a pandemic. It has clearly changed a lot. We have had to adapt in many ways. We've had to run board meetings and run these international societies where we have board members from the whole world completely virtually for over a year and a half. That's a great challenge. Zoom and video has helped us extremely, but it doesn't replace face-to-face meetings and the discussions you have in between one-on-one. We have a fantastic office that has grown in London to help support the amount of activities we have. And this office with 9 people is working completely from home since over a year and a half. That's a great challenge too. And I must say, Joe Groves, our executive director, has done a great job in making that seamlessly move forward so that we can really attain the goals we had fixed. And we've moved forward really with all our projects very successfully. The scientific program for Singapore is nearly finalized with a wonderful program that's being developed. I encourage you all to already mark your calendars for the Singapore meeting. The World Congress of Dermatology in Singapore, we hope will take place live. That is now exactly 2 years away. And by then, I hope the health situation worldwide has improved such that we can meet face to face again. So, I wanted to ask you, Harvey, uh, um, from your side, we've seen how much digitalization has helped us survive at a professional level in these really challenging times where no travel is allowed from one day to another. And you have a rich experience in IT, and I'm really so grateful for what you have done during your presidency in modernizing the LDS, completely due to also your strong knowledge about IT. And yeah, it would be interesting to know from you, where do you see exciting future developments in the future, and how do you see this could impact dermatology?
Yeah, well, I think the thing that's really I'm grateful for is the fact that we've have all this technology, the internet. I can't imagine what it was like, in the 1918 pandemic in the world that, caused so much devastation, but the world eventually recovered from it. But, they had no internet. They had very little technology, and yet they made it through. I think that one thing is that every one of us has had to embrace the technology. So it doesn't matter where you were, you had to adapt, you had to pivot to using the internet as part of the core of your work. You had to pivot for education, for patient care. And, perhaps these things would have been inevitable. But what's really quite fascinating is we've kind of entered an experiment where we basically accelerated the progress by probably at least half a decade or more, compressed it into a year and a half, and we moved to the future very quickly. So, telemedicine, teleeducation is never going to be the same. We now know that artificial intelligence is here to stay. And so we've been working within the ILDS on a number of different projects. One of the projects that we're going to be launching is the ILDS image gallery, which is going to link images with the ICD-11 system that's just being released by WHO in collaboration with ILDS. So I think it's very exciting, all the technology that we've been forced to use. We'll continue to use that, and we're going to come together in Singapore to talk about the best ways to leverage this technology so that we can elevate dermatology even higher. So it's exciting times, and we've been forced into it, but I think we're all going to come out ahead because of that. One of the things that has really been dramatically changed over the last year and a half has been the social upheaval, as you mentioned. And I'm just wondering, I think people that follow the ILDS and our members and dermatologists kind of want to know what's the ILDS going to be doing in terms of equity, diversity, inclusiveness, all these things that, we've always done before, but we need to do even more now. And I'm hoping that the ILDS is going to have a big role in that. And maybe you could share some of those ideas and thoughts.
Right, so this is really important for us, and we've been working on making a codex and statement for the ILDS, what we expect as far as equity and inclusion and diversity is, and by what examples we want to move forward in that field. Obviously, for us, from a medical perspective, inequalities is one of the big themes we are looking at, and we're working very hard to try and diminish these by trying to define where are there inequalities in access to care. An example here is the great work that's been done by the Global Psoriasis Atlas, which you can find online, and which is defining where are there gaps in access to care around the world. And by better defining them and providing numbers, and this is work that Chris Griffiths and his team are leading, we are able then to link, as the ILDS being in official relations with the WHO, to link with the WHO and try and say, here really is the data. We need to do something about making access to care better in this part of the world. And by our official relations with the WHO, we work very closely also with the Essential Medicines Department. So we have possibility to bring medications, and we're trying to do that, bring modern therapies for psoriasis, for example, on the essential medicines list, so that each country should feel obliged to offer that to their population. So that's just one example. We're trying to improve networking also to get rid of these inequalities in care. Networking, for example, in building now a global partnership for education and care, where departments in different areas of the world will pair together and try and improve and increase the level of care worldwide. And then we are also trying to engage with partner societies, and have done that very effectively over the past years in providing better care in certain parts of the world. And one beautiful example here that everyone knows about is the Regional Dermatology Training Center in Tanzania, and how this contributes to better care in Tanzania, but also to education of physicians taking care of patients with skin diseases. So these are just some examples how the ILDS is really taking inequalities seriously and trying to make a difference at that level.
That's great. I mean, you know, we've been apart, but we've been busy, and it's very exciting to hear about these things. And I think, you know, we've got a lot to report on when we get together in Singapore in a couple of years, clearly.
Yeah, great talking to you, Harvey. I'm looking forward to live meetings again. That's really the heart of our society, is meeting together, meeting with our colleague dermatologists, meeting with the patient associations, patient representative associations. We're working more and more closely with them. And Singapore, this wonderful Congress, World Congress coming up in Singapore under the direction of Roy Chan, will be a success and will bring us together. I really look forward to that. Great talking to you, Harvey. Let's keep it.
Sounds good. Take care. See you, Lars.
Bye.